Are we live? Let me know. Got it. So we're going to start here today. All right. Meeting is now live streaming. Okay. So it appears it's high. Okay. So today we're going to be discussing, we're going to get your swole on. Okay. We need to understand what intracellular and extracellular fluid does. Now, as you guys know, over the last couple of years, we've been focusing on body composition. Now, we've been able to uncover some real deep level of science in terms of body composition and the awareness of inner cell and out of cell environments. We have some basic knowledge, and the knowledge is that the more swole the inner cell is, the better it's going to be. Now, in terms of what we're looking at is when we look at our body composition assessments, we're going to use me as an example today in terms of our body assessment and composition studies. We assess our patients by evaluating their body composition and determining how much muscle, how much water, how much intracellular, extracellular fluids they have. So we've been able to uncover some certain pieces of data when we compile our patients. Now, we do know that phase angle is a very important component of health. Now, phase angle is the determinant that we actually send electrical current throughout the body and determine the health of a true cell wall. So today we're going to have a little discussion specifically of how to get your swole on, because we can actually measure the intracellular versus extracellular water that is inside the cell and determine if someone's real healthy or not, or more healthier than a different variable. Now, when we look at these kind of studies, we've been able to evaluate this. So Anna, let me ask you first. When you look at intercellular water, what is it you're looking for versus extracellular water, meaning water that is outside of a cell?
Well, if we're talking about intracellular water, we're talking about cellular integrity. We need water to communicate through cells. We need water to communicate or to propagate nutrients across the cell membrane or to make it function. But if we're talking about intracellular water, we're talking about integrity inside of the cell. If we're talking about extracellular water, we're talking about communication. However, we need to have like a constant ratio, or we need to have like a constant distribution of this water. And for this to happen, it needs to be a balance of between those specific nutrients that are outside the cell and inside of the cell. And it also has to take into account the fact that we have a phospholipid membrane that takes care of that balance. So it has a lot to do with proteins. It has a lot to do with nutrients. It has a lot to do with protons and with sodium and potassium. So we look for this specific marker to be able to determine if our patient is swollen, if the patient has a little bit of inflammation in a specific part of the body, because that is the kind of information that we can get from the in-body results. And we use it we are currently using it to determine if we can find an association between the fitness score and what they can do to improve their endurance while they are exercising.
I guess what we're talking about today is, as we start evaluating cells. Okay. So if we look at cells, we can just draw my little two cells here, and let's assume this is the surface area. We talk about this intracellular water versus extracellular water. Okay. So what we're trying to do is see that a person who has a more swole cell, okay, is basically, and this is comparison between this one and this one, is a healthier individual with a less amount of, let's say, fluid outside. This is, let's say, a fluid level here, and here there's a lot of, let's say, a lot of fluid collection here. Okay. So when we look at this kind of dynamics, and I apologize, my drawing, what we're trying to do is figure out and measure these variables. So what we're able to do now is we're able to see a true health dynamics occurring in an individual. Now, when we look at that, what we're looking for is we're looking at the at the true numbers that we're actually seeing here. So here we have a typical assessment. This happens to be mine, that we look at intracellular water versus extracellular water. We look at dry lean mass. We also look at body fat mass content, right? So, you hear bodybuilders and let's get my swole on, right? So, which alludes to the title on this, because when you get your swole on, you feel better, right? So you get like, you feel more fit. We're also noticing that athletes, when they are training for, let's say, competitions, there's a balance of level of intracellular and extracellular fluids. So what we need to do is we need to look at what our studies are reflecting. Now, these are a short series studies where we can actually see a certain amount of patients, right? And what we look at is we've talked about phase angle, and the higher the phase angle, the healthier the individual, right? So we also notice that the lower the phase angle, the 2.2 would be relatively low, okay? Therefore, we have an unhealthy dynamics, okay? Versus a higher phase angle individual, which would be high in the upper, close to a 10, let's say 8.1. These individuals, and if we're looking at this new factor here called the swole factor or the swole hedge factor that we've been able to kind of identify, we're seeing that the numbers rise between a 45 and a 30. Okay. So when we start noticing a 45 being able to retain, in other words, the cell is able to retain 45% more water than the outside environment of the cell. Okay. So when we're going back to the example, the ability of a cell to hold onto water determines its health, all controlled by the cellular membrane. Now, when we study the whole cellular membrane dynamics, we're actually measuring the phase angle, which tells us the electrical current that we're actually seeing. So when we do these studies, we look at a couple of other variables. And as we look at these dynamics, we start looking at things such as impedance of a cell wall. When we talk about phase angle in this particular situation, I have a phase angle of a 6.3. How do we figure this out? We figure this out by sending low frequencies to higher frequency hertzes through the whole body dynamics. Once we figure it out, we give an average number. This tells me my overall health of my body, right? So what we need to know is that the higher the phase angle, the higher electrical, current dynamics inside the cell, outside in the cell membrane, which allows us to have a better phase angle. That means you're healthier. A low phase angle would be an unhealthy dynamic. So we're able to identify, and today we're actually seeing studies that use phase angle to determine and screen out precancerous, pre-disease states, such as diabetes, such as cardiovascular issues, such as even mitochondrial deficiencies like neuropathies. This determination is all being assessed at the cell membrane. So when we're doing these kind of dynamics, we're looking for these variables. So as you can see here, we can actually see an individual who has a phase angle of an 8.1, which has a fitness score of 100. Now, in reverse, we can actually see from this small study that we did, we pulled about 500 patients from this, we can actually see that the phase angle for certain individuals is a 2.2 and their fitness score is a 41. But if we take a look at that dynamics, we also look at the intracellular, extracellular fluids, and I do believe we lost the, do we lose the hedge angle?
No, that's fine.
Yeah, it kind of lost, huh? Saw it?
Mm-hmm.
So let's kind of refresh the page and let's see what we got here. Okay, so when we start looking at that, let me kind of go and let's go to 50. What is it? 50? All records? No, it's the HIPAA.
Yeah.
There we go, HIPAA. So when we look at these particular records, we're actually seeing the overall health, and you can see the intracellular fitness score and the phase angle. So it appears we lost one of our components there. So when we look at the dynamics of that, we're seeing that overall fitness level and intracellular fluids, we can see the ratios develop, okay? Now, as we kind of look at this dynamics, we're going to be able to assess and determine an overall health of an individual. So when we see a phase angle that is low, we have a fitness score that is low. When we have a phase angle that is high, we're actually looking at an individual that's got a high fitness score. Okay. So we're basing this off of intracellular and extracellular fluids. Okay. So we notice that intracellular fluids, if it's higher, the ratio becomes an important component. So as we're measuring these dynamics, we can actually see in terms of athletes, certain athletes have tight systems where it's very little fluid maintaining extracellularly, okay, and a lot is maintained intracellularly. you can see the difference between an individual who is off season and on season. In this situation, you can assume that this person has a much more level of extracellular fluid, if that makes sense. So as we look at extracellular body fluid versus intracellular fluid, you can transition as you do these dynamics. So our goal here is to create an awareness as to what's going on and in terms of the fitness dynamics that's actually occurring in the patient. So when we look at these kind of dynamics, what are the things that we can do to increase, let's say, intracellular fluid and decrease extracellular fluid retention? Adriana, you particularly, you work with patients, and what we want to do is we want to increase their phase angle. So when we have an individual with as a high phase angle, or that is actually a healthier individual, or a person has a low phase angle and they have a lot of extracellular fluid retention, what is one of the things that we do to establish a normalcy or create at least a homeostasis between that?
The exercise is very important in this balance of the water, because of course you want to retain the water inside of the cells. Imagine your cells being like grapes, and if the water is outside of the cell, the extracellular water, you're going to have little raisins. They're going to dry out, and the muscle is not going to be able to grow, and you're not going to be able to prevent inflammation. So you want to have the water in the cell, the intracellular water. So the grape is healthy and round. You would see a very juicy, healthy grape, and that would be with exercising and good nutrition. That way you have the balance that you need in your body to prevent any inflammation. And
we have been able to see the changes within 2 weeks in terms of the activity level. If someone starts with the cardiovascular work, it seems kind of obvious, but you can actually pump the fluids out of the system and actually make the cells healthier by increasing the intracellular water, which indicates, what are we doing? We're actually increasing the health of the cell membrane. So as we do that, I guess the impedance and the capacitance between the cells becomes much more logical. Now, for those that don't know, the cell wall is a bilipid layer, okay, which acts as a capacitor in many extents. So, and it holds charge. So a lot of our systems are controlled. Most of our systems are controlled by that cell membrane. What is allowed in and out of the cell determines its health. So the ability for the cell to maintain its hydrostatic, its water, so to speak, or its volume of fluid determines its health. A cell that doesn't, by default, indicates that the cell is losing its ability and its strength. So we look at those things. In terms of nutritional aspects, Anna, what are the kind of things that you do that help people, let's say, return to a normal dynamics inside the cell?
Well, if we're talking about intracellular body water and extracellular body water, we need to figure out what is the thing that is causing that leakage of the inside of the intracellular body water to the extracellular side. So it's very important to know if the patient is drinking the right amount of water and if he's eating the right amount of protein. So that is crucial in the nutritional aspect of how to determine if the intracellular ratio is doing all right. So that is the first thing. But of course, exercise has to do a lot with that, because it is our mechanism of maintaining that balance. So it's crucial for it. Nutrition should always be followed with an exercise program.
You know, there's extremes, and sometimes we can learn from extremes, like ascites, which is a disorder that actually there is a low level of albumin, or actually poor nutrition in that extent. The level of albumin is minimized, and the orthostatic and the hydrostatic pressures in the body change as a result of its inability to hold water. Well, the water ends up leaking outside the cells and end up going not only to the extracellular tissues, but into cavities inside the body in the peritoneum, and patients have large bellies of water. That's extreme poor nutrition. But it gets the point on the other side. A bodybuilder who works out, and they work out, or an athlete that works out a lot, you can see that if they overload their body, they become almost ashy and depleted, and they lose their ability to hold water. And a lot of the glucose is, and at least the the normal products of cellular metabolism, such as glycogen, are diminished in the body. And once the person loses their glycogen, they feel weak and they don't retain water inside their cells. Once that the body retains and restores back the glycogen, so you have like certain drinks that bring in the glycogen or increase the sugar levels, that increases the hydrostatic pressure within the cells and actually brings normalcy, and the color of the human actually starts changing right in front of you. So it's an amazing dynamics when you can actually measure the amount of changes. Now, when would we also evaluate this? In a time when an athlete's trying to determine and they're trying to compete, we want to push the body. You can actually measure the amount of intracellular water versus extracellular water. And the higher the intracellular water is, it tells you that your body is moving in the right direction of athleticism, so to speak. On the contrary, if you're becoming depleted and you're losing your ability to become fit, then you're going to know that extracellular fluid is now diminished in that region. What are the things that we notice in terms of faith? The wellness dynamics. What has been your experience in terms of intercellular and extracellular fluid within the cells?
So intracellular water, you want that to obviously be higher than the extracellular water, meaning that the cells are absorbing water as they should. If we see that a patient isn't absorbing water as they should and that value is a little bit low, then we can start to say, oh, you need to exercise more, or maybe you're deficient in certain minerals, because minerals allow us to absorb water as we should. So those are the values that we want to pay attention to and make sure that the ratio is correct.
There you got it. So as we're looking at these dynamics, we're actually seeing the results. So going back to our studies, as we evaluate these individuals and we start seeing these particular results in our in-body assessments, we not only look at the water, we also look at the body capacitance, okay, which also lets us see exactly what's actually happening inside the cell. So let me kind of pull this over here. We're also going to be able to see what their muscle mass index and what goes on. So not only are we looking at the physiological component, but we're looking at the physical components, because many times patients come in here with just pain and a joint problem, but we're able to see that their overall healthy state at the musculoskeletal level and also their physiology is altered. So we need to be able to restore through nutrition, exercise, and lifestyle changes. So one of the things we do is we use these tools to be able to assess. Adriana, in terms of your results and in terms of what you've seen in patients in the past, have you noticed any changes in patients that are active or athletic and change their phase angle through a series of exercises?
Yes, definitely. The face angle is related to the exercise and the fitness level. So you will see a change with 2-3 weeks of exercising, a month of exercising. You can see already a change in the body index, in the body fat mass, and of course in the face angle.
Excellent. So Anna, tell me a little bit about what your experience is with the phase angle dynamics over a period of time.
Well, something that I have noticed about the face angle is that it's very important in critically ill patients. So the face angle can also help us to know what is going on with the cell. So something that happens is that whenever we have a critically ill patient, the
Okay. So sorry about that, guys. Okay.
the intracellular water starts to come out to the extracellular compartment, and this happens just for the body to have enough resources for it to move, and also it bypasses a lot of the proton bombs, and with this it makes like a saving mode, a serving energy saving mode, so they do not use as much ATPs because the cell can not longer produce that amount of energy to pump out all the different electrolytes that you need. So that is very important for the face angle, or personally, I like that about the face angle because it allows me to know that that is happening in the body of the patient if it's critically ill. But if we have an outpatient and we see that the face angle is actually improving, we have to take into account that the face angle also measures the amount of cell mass that we have in our body. So we need to take into account the fact that if we're losing weight, then the face angle will be lower, but we need to go back and see what is going on with the body fat mass and with the percentage of muscle mass. So we have to take all of the information and gather all our theoretical information and see what is going on with the patient. So it all depends in the patients that we're seeing currently.
Let me ask you something. We've learned about betaine. We've learned about things like creatine. What are the things that we're noticing? And people know for years that creatine is used for from anti-cancer to fitness to increase strength. Actually, not only just increase strength, but increase power, primarily power over the strength components. So, what does that mean when someone increases power versus strength? Because we're seeing that when you take certain supplements, such as creatine or betaine, we're noticing that there are changes in the strength curves. Tell me a little bit about the difference between the power that we're noticing when cells are fully hydrated versus less hydrated.
Well, something about power is that it has to do with the fact that we can prolong our exercising for a little bit longer. So for example, if I'm lifting up 100 pounds, I am able to do it for a lot of repetitions. However, if I'm focusing in strength, that means that I'm upgrading from 100 pounds to 120 or to 130, but I'm only keeping like a small repetition. So that is where you have to differ from strength and power. So by power, you almost want to make it equal to endurance. So that is something very important to know. So specifically talking about betaine, betaine is very important for, it's a methyl donor. So of course, as part of a very important methyl donor pathway, you have to learn that it has to do with lowering the amounts of homocysteine in our body, which will lower the oxidative stress and will promote health. Ultimately, it will lead to all of the production of S-adenosylcysteine, well, SAMe specifically, and will lead to serotonin, will lead to a lot of good things. So also, something that has been brought up in different research papers is that betaine can also improve the amount of muscle mass in people who are exercising. So that is something that has been compared to people who are, or mostly animals, and they did these studies on pigs. So when pigs were supplemented with betaine and not being able to exercise, they gained no muscle mass. However, when they were supplemented with betaine and had a little bit of more range to run around and exercise, they increased their muscle mass. So it is crucial to mix something that has to do with nutrition with exercise. And talking about creatine, we have to know that creatine, well, first of all, we needed to promote endurance. That is very important, but also it creates like a swallow factor, the swollen factor in our cells. So if we have like Adriana said before, like a grape instead of a racing of a cell, we are able to promote more work, more endurance, more power. So that is something that we need. And it has to do a lot with extremes. If we have an extreme athlete, then he will have some specific measures or some specific factors that we want to observe. If we have an extremely ill patient, then it will be different. But however, we can use the same measurements or the same factors to measure how they are doing.
Excellent, excellent, good points. And we do that for our athletes, our extreme athletes, such as wrestlers, such as our CrossFitters. We want to do a reassessing of that, of their factors, from the phase angle to the intra-extracellular body fluid waters, which tells us the overall health of the individual. Which then now, as Anna indicated, a lot happens, but you got to do a lot too. So for example, you can't see the effects unless you exercise, right? So that's what's critical important. So as your body throttles up, as the indicators throttle up, now we have the ability to see how healthy the cells are. We don't have to use that like, I feel better, I feel tighter, whatever. No, we actually can measure the extracellular body fluids and actually see what is actually happening. This is great for the season. So you start the season with assessing your body composition, and a quarter of way through, your body starts changing quite a bit. For wrestlers, they start at 100 and let's say 80 pounds. They go to one, and their goal is they got to be at the 155 weight class. So as that happens, there's a flux of water issues and intra and extracellular fluids that alter not only the ability for them to battle, but if you take out the extracellular fluid or an imbalance of intracellular fluid in the wrong direction, you may actually make yourself weaker. That's why there is a period of time that you want to attain your body weight to allow your body to restore its normal orthostatic pressures. Make sense? So we don't want to just drive into the 155 weight class the day before. Okay. We want to allow the body to establish its normal balances and see what's actually going on. So there's a lot of science in this. Now we can take this also with individuals that have cardiovascular issues and joint problems and diabetes and obesity and density issues on muscles. So sarcopenia, we can actually evaluate the changes as we're showing the improvement little by little. So, I just wanted to give you the insights as to what we're learning here. So we're with our patients as the data starts rolling in. So as we do this, one of the things is people ask me, can I do this? How often? Well, it depends on what you're doing. If you're not doing much, well, once every couple of months is fine. But if you're an extreme athlete, then we want to monitor you on a regular basis, maybe every 2 weeks, to see what the changes are. So we can actually see that. And our tools will give you the insights as to what's going on. So I appreciate you guys. Little by little, we were talking about intracellular, extracellular to get your swole on, because we want to get those cells real healthy. Okay. And the bottom line is, the more powerful the cell is and the cell membrane is, the healthier the individual. Whether we measure it through phase angle or measure the amount of volume, the water, inter and extracellular, we actually can determine different components. So thank you guys very much. And we look forward to next time we chat about the new topic, and depending on what it is. So thank you, Ms. Faith. Thank you, Adriana. Thank you, Anna. And we look forward to hearing you next time. Okay, guys, you have a good one.